All right, so we're diving deep into healthcare in Himachal Pradesh.
Beautiful area.
Yeah, breathtaking beauty.
Absolutely.
But definitely some tricky terrain
Yeah.
to navigate when we're talking about healthcare.
Yeah.
We've got a whole stack of research here
Okay.
about how their healthcare system is tackling those challenges.
Right.
And we're talking government programs, doctor shortages, and even some high-tech solutions that sound straight out of the future. So,
Yeah, it's really interesting.
are you ready to get the need-to-know info?
Absolutely.
Without the info overload.
Let's do it.
Okay, great.
Himachal Pradesh is really a fascinating case study.
Okay.
You've got high literacy rates, significant investment in healthcare.
Uh-huh.
But that mountainous landscape creates some really unique obstacles.
Yeah, okay, so let's kind of map out this healthcare system.
Sure.
It's described as having like a 3-tiered structure.
Okay.
What exactly does that mean for, someone actually living there?
So imagine it like this. You've got primary health centers, the PHCs, tucked away in villages offering that initial point of contact.
Okay.
Then you step up to community health centers and district hospitals with a broader range of services. And finally, for the most complex cases, you've got specialized medical colleges.
Okay.
Like IGMC Shimla.
So, in theory, a clear path to different levels of care.
Right.
But then throw in the Himalayas, and suddenly that path looks more like a pretty intense hiking trail.
Exactly. Think about it. Scattered villages, snow-covered, passes, landslides.
Oh, yeah.
For many people, accessing even basic health care involves a journey that most of us wouldn't even consider for, say, a trip to the grocery store.
Right.
Yeah.
It almost makes you wonder if just building more hospitals is even the right approach.
Yeah.
But before we go there, let's talk about the government's role.
Okay.
They've got a bunch of programs trying to make healthcare more accessible and affordable, right?
Himcare, for example, is their state-run health insurance scheme.
Okay.
It acts as a safety net
Go.
for those who might not qualify for the national Ayushman Bharat program.
Okay.
And then you've got free medicine programs trying to ease the financial burden of at least basic care.
So they're not just relying on national initiatives, they're taking action at the state level, too.
Yes, definitely.
But is that enough to actually solve the problem?
Well, that's where things get interesting.
Okay.
They're also exploring some really innovative solutions.
Like what?
Like telemedicine, for instance.
Okay.
Doctors in Shimla can now consult with patients in remote villages. And in some cases, that's reduced travel time by 90%.
Okay, that's a pretty impressive stat, but telemedicine only goes so far, right?
Of course.
I mean, you can't exactly perform surgery over a video call.
Right.
What happens when someone needs more specialized care?
That's a crucial question, and it leads us to one of the biggest challenges facing Himachal Pradesh. This shortage of doctors, especially specialists in rural areas.
Wait, really?
Yeah.
You'd think those mountain views would be a doctor's dream.
You'd think so?
What's causing that shortage? Is it a lack of training opportunities or something else entirely?
It's multifaceted, but a big factor is simply the draw of city life.
Okay.
Better infrastructure, more career opportunities, the list goes on.
Right.
And this lack of specialists forces patients to undertake really arduous journeys, highlighting the healthcare disparity between urban and rural areas.
That's a stark reality check.
Yeah.
So even with all these programs and innovative ideas, there are still some serious roadblocks.
Definitely.
But before we get too bogged down in the doom and gloom, you mentioned some other intriguing solutions.
Yeah.
Things like helicopter ambulance services.
Exactly. HEMS, as it's called, is being explored as a way to reach those truly remote communities.
Okay.
And then there's the potential of public-private partnerships, which could bring in much-needed resources and expertise.
HEMS is an intriguing idea.
Yeah.
But how feasible is it given the costs and logistical challenges in this terrain? And what about those partnerships? What kind of impact could they realistically have on the ground?
Yeah, those are all important questions.
We're going to need more details on those.
Absolutely. And that brings us to another crucial element.
Okay.
The human element. We've talked about systems and programs.
Right.
But what about the experiences of the people actually living and seeking care?
Right.
In Himachal Pradesh, their stories are key to understanding the true impact of all these efforts.
That's a great point. So are we ready to hear what they have to say?
Let's do it.
Because I'm all ears.
All right. Welcome back now. Let's hear what the people of Himachal Pradesh have to say about their healthcare experiences.
Okay.
It's one thing to look at the big picture, those statistics and programs,
Right.
but those individual stories, they really paint a vivid portrait.
Totally. I'm ready to hear those firsthand accounts. What kind of insights were we getting from
Yeah.
those who are actually navigating this healthcare system every day?
Well, one thing that comes up consistently is appreciation for the government's efforts
Mm-hmm.
to make healthcare more affordable.
Okay.
People are genuinely grateful for programs like Himcare
Yeah.
and the free medicine schemes, especially in a region where many are struggling to make ends meet.
That makes sense. Those initiatives can be a real game changer when it comes to basic care.
Yeah, absolutely.
But I'm guessing those positive feelings don't erase all the challenges, right?
Unfortunately, no. The doctor shortage, especially the lack of specialists in rural areas,
Right.
it's a source of constant frustration.
Okay.
We hear stories of people having to travel for days,
Wow.
sometimes even to other states,
Yeah.
to get the specialized care they need.
I can only imagine the toll that takes, not just financially, but emotionally as well.
Yeah.
Having to leave your family and support system behind to seek treatment must be incredibly difficult.
Exactly. And those long journeys are often physically demanding,
Oh, yeah.
especially for the elderly or those with chronic conditions. It really highlights the healthcare disparities
Yeah.
between urban and rural areas.
So you've got these incredible landscapes.
Yeah.
But those same landscapes create huge barriers.
Yes.
To accessing quality care. It makes you realize how much we take for granted living in cities with hospitals
Sure.
and specialists just a short drive away.
It really does put things into perspective. And it's not just about the physical distance either.
Okay.
There's also the issue of trust.
Mm-hmm.
For some traditional healers or alternative medicine practices hold more weight
Right.
than modern medicine.
I remember reading about that. It's a reminder that healthcare isn't just about science and technology.
Uh-huh.
It's deeply intertwined with cultural beliefs and individual perceptions. So how do you bridge that gap? Can modern medicine and traditional healing practices coexist?
That's a key question, and it's something Himachal Pradesh is actively grappling with.
Okay.
There's a growing recognition that a more holistic approach is needed,
Yeah.
one that respects and integrates
Right.
different systems of healing.
That makes a lot of sense, but it also sounds like a delicate balancing act.
It is.
How do you ensure that those traditional practices are safe and effective while also embracing the advancements of modern medicine?
It requires open dialogue, cultural sensitivity, and a willingness to learn from each other.
Yeah.
It's about acknowledging the strengths of each system and finding ways to collaborate for the benefit of the patients.
It's about meeting people where they are, both literally and figuratively.
Right.
But let's get back to those innovative solutions we were discussing. HEMS, those helicopter ambulance services.
Yes.
Sound amazing in theory, but practically speaking, how are they being implemented?
Well, it's still in the early stages.
Okay.
And the mountainous terrain definitely poses some logistical challenges.
Right.
But we're seeing pilot programs in certain districts, and the initial results are promising
Okay.
for critical cases or those in extremely remote areas.
Yeah.
HEM can be a true lifesaver.
Okay, so maybe not a widespread solution just yet, but definitely a ray of hope for those who are hardest to reach. What about those public-private partnerships? How are they shaping healthcare in Himachal Pradesh?
They're proving to be quite impactful. One example is the involvement of private labs
Okay.
in conducting diagnostic tests for government hospitals.
Got it.
This not only increases efficiency, it also helps alleviate the strain on already overburdened
Yeah.
public facilities.
So a win-win for both sides. The private sector gets involved and the public benefits from improved services.
Exactly.
But are there any concerns about this kind of collaboration? Does it create a two-tiered system where those who can afford private care get preferential treatment?
That's a valid concern, and it's something that needs to be carefully monitored.
Right.
The goal of these partnerships should be to strengthen the overall healthcare system,
Right.
not to create further divisions.
Transparency and equitable access are key.
Absolutely.
But it sounds like these partnerships have the potential to address some of those resource gaps we've been discussing.
And they do.
Speaking of resources, we've talked about the doctor shortage, but what about the hospitals themselves? What's being done to improve infrastructure, especially in rural areas?
That's another area where we're seeing progress.
Okay.
There's a focus on upgrading medical equipment and facilities,
Okay.
as well as ensuring reliable power supply,
Oh, right.
which can be a challenge in remote areas
Yeah.
prone to outages.
Reliable electricity is something most of us take for granted,
Yeah.
but in a medical setting, it's literally a matter of life and death. I can't even imagine trying to perform surgery or care for patients during a power outage.
Exactly. And it's not just about the buildings and equipment.
Right.
They're also investing in training community health workers to provide basic care and health education in their villages.
So kind of like extending the reach of the healthcare system into the heart of those communities.
Exactly.
Empowering people to take charge of their own health, even when a doctor isn't readily available. That's a really smart approach.
It is.
But I'm curious, are there any unique health challenges specific to Himachal Pradesh? I mean, we've talked about the terrain.
Sure.
But are there other factors at play?
Absolutely. The climate and geography contribute to a higher incidence of certain illnesses.
Okay.
Respiratory problems are common, especially during the harsh winters.
Right.
And then there's the monsoon season, which can lead to a surge in waterborne diseases due to strained sanitation systems.
Right. I remember reading about that in one of the articles. Poor sanitation can be a breeding ground for all sorts of health issues.
Definitely.
So it sounds like addressing those infrastructure gaps isn't just about making hospitals nicer. It's about public health and preventing outbreaks.
It is a public health issue for sure.
And then there's the risk of zoonotic diseases, those transmitted from animals to humans.
Right.
Which are more prevalent in rural areas.
Yes, exactly.
Rabies, or are we talking about something more exotic?
Well, rabies is always a concern.
Yeah.
Scrub typhus is a particular threat in Himachal Pradesh. It's a bacterial infection spread through the bite of infected mites, often found in areas with dense vegetation.
Okay, that's enough to make anyone think twice about venturing into the wilderness. But seriously, it highlights the importance of public health education and awareness.
Yes.
Especially in those rural communities.
Absolutely. Knowing how to protect yourself and recognize the early signs of these diseases can make a huge difference.
So it's a complex web of challenges, but it sounds like Himachal Pradesh is taking a multi-pronged approach, addressing everything from infrastructure to public health education to cutting-edge technologies like telemedicine and HEPSINs.
They are.
That's encouraging to hear. But I have to ask, what about technology's role in all of this? We've touched on telemedicine, but are there other ways technology is being used to bridge those healthcare gaps?
Oh, absolutely. Technology is playing an increasingly vital role, especially in remote areas like Himachal Pradesh.
Okay.
One area where we're seeing significant impact is mobile health, or e-health.
Health? Is it like using fitness trackers and health apps?
That's part of it, but it goes far beyond that.
Okay.
Think about using mobile phones to deliver healthcare services, information, and education directly to people's hands, even in the most remote villages.
Wow, that's powerful. So things like reminders for vaccinations, remote consultations with doctors, even access to vital health information, all through a device that most people already have. That's incredible.
It is, and it's particularly effective in areas where physical access to healthcare facilities is limited.
Right.
It's about empowering individuals to take control of their health, no matter where they live.
Okay, that's PM Health. What else is on the tech horizon?
Well, there's this shift towards electronic health records, or EHRs.
Okay.
Think of it as the digital version of those bulky paper files. With EHRs, patient information can be stored and shared electronically, improving coordination of care and reducing errors.
Especially important in a region where patients might be seeing different doctors in different locations.
Yes, exactly. EHRs help ensure that all healthcare providers have access to the same up-to-date information about a patient's medical history, medications, and allergies, no matter where they seek treatment.
That kind of seamless communication could literally save lives. But what about the really cutting-edge stuff? I'm talking artificial intelligence. AI, is that playing a role in Himachal Pradesh's healthcare system?
Absolutely. AI is being explored for a wide range of applications, from analyzing large data sets to identify trends and patterns in health outcomes, to personalizing treatment plans, and even developing more effective preventative measures.
So AI isn't just about robots performing surgery. It's about using data to make smarter decisions and improve healthcare delivery on a systemic level that's pretty mind-blowing.
It is, and it has the potential to revolutionize healthcare, particularly in resource-constrained settings like Himachal Pradesh.
Okay, this is all incredibly fascinating, but I have to admit, my brain is starting to feel a little overloaded. It's like drinking from a fire hose of information.
I understand.
We've covered so much ground, from traditional healing practices to high-tech solutions, and I'm still processing it all.
We've covered a lot of territory in this deep dive.
Yeah.
But it's a testament to the complexity and dynamism of healthcare in Himachal Pradesh. They're not just facing challenges. They're actively seeking solutions and embracing innovation.
That's really inspiring to see, but I have to wonder, with all this focus on technology and innovation, Is there a risk of losing sight of the human element?
Hmm.
I mean, healthcare is ultimately about people, their needs, their experiences. How do we ensure that those voices aren't drowned out by the buzz of the latest gadgets and algorithms?
That's a crucial question, and
Uh,
it brings us to the heart of what makes healthcare truly effective.
okay.
It's not just about having the best technology or the most efficient systems.
Uh-huh.
It's about understanding the people we're serving.
So in the next part of our deep dive, we're going to shift gears a bit and really focus on those personal stories, those human experiences that illuminate the true impact of healthcare in Himachal Pradesh.
That's exactly. We'll hear from patients, doctors, community health workers, those on the front lines of this healthcare system. Their insights will provide a powerful reminder that behind all the data and technology, there are real people whose lives are being shaped by these efforts.
Okay, I'm already intrigued. I can't wait to hear what they have to say. Welcome back to our deep dive into healthcare in Himachal Pradesh. We've explored the system, the challenges, and the innovative solutions emerging from this unique landscape. But now it's time to shift our focus to the heart of it all, the people.
What's fascinating is how diverse those experiences can be.
Right.
Someone in a remote village might have a completely different perspective from someone in a larger town,
Yeah.
even within the same state.
Okay, so let's try to capture that range of voices. What are some of the common threads or feelings that emerge from these personal stories?
A consistent theme is gratitude
Okay.
for the government's efforts to make healthcare more affordable. People truly value programs like Himcare and the free medicine schemes. These initiatives offer a crucial safety net, especially for those in remote areas where earning a living can be challenging.
It's a reminder that healthcare isn't just about fancy hospitals and cutting-edge technology. It's about ensuring that basic care is accessible to everyone regardless of their economic circumstances.
Absolutely.
Yeah.
But alongside that gratitude, there's also frustration, particularly regarding the shortage of doctors and specialists in rural areas.
We've talked about that doctor shortage, and those personal stories really drive home the impact. It's one thing to see statistics, but it's another to hear about individuals forced to travel for days separated from their families just to see a specialist.
Exactly. And imagine the added burden for the elderly or those with chronic conditions.
Oh, yeah.
These journeys aren't just inconvenient. They can be physically and emotionally exhausting.
Yeah.
It creates a sense of vulnerability and isolation.
It also raises questions about equity. Are we truly providing equal access to healthcare if those in rural areas face such significant barriers? It makes those urban-rural disparities impossible to ignore.
It's a critical issue, and it's not just about the physical journey. There's also the challenge of trust. For some, traditional healers and alternative medicine hold more sway than modern practices.
That's an interesting point. We often think of healthcare as a purely scientific endeavor, but it's deeply interwoven with cultural beliefs and individual experiences.
Precisely. And that highlights the need for a more nuanced approach, one that acknowledges and respects those different perspectives.
So how do we bridge that gap? Can modern medicine and traditional healing practices coexist? Is there a way to integrate those different approaches without compromising safety or effectiveness?
That's a question healthcare providers around the world are grappling with.
Yeah.
In the context of Himachal Pradesh, there's a growing movement towards a more holistic model,
Okay.
one that incorporates both modern and traditional practices.
It's about recognizing that healthcare isn't one size fits all. What works for one person might not work for another, and those cultural beliefs and personal preferences play a huge role.
Absolutely. It requires open communication, cultural sensitivity, and a willingness to learn from each other. It's about building trust and finding common ground.
So we've got gratitude for the progress, frustration with the persistent challenges, and a growing desire for a more inclusive approach that respects diverse beliefs and practices. What else are we hearing from the people of Himachal Pradesh?
There's a strong sense of community and resilience that shines through.
Mm-hmm.
You hear stories of neighbors supporting each other, sharing resources, and advocating for better healthcare in the villages.
Yeah.
It's a reminder that even in the face of adversity, people find ways to connect and help each other.
That's heartwarming to hear. It speaks to the power of human connection, that even when the system falls short, there's this underlying spirit of community that steps in to fill the gaps.
It's truly inspiring, and it reminds us that healthcare is more than just policies and programs. It's about people coming together to care for one another.
So as we wrap up this deep dive, I'm struck by the complexity of it all. We've seen the data, we've explored the innovations, and we've heard those personal stories that bring it all to life. What's the most important lesson we can take away from this exploration of healthcare in Himachal Pradesh?
I think the key takeaway is that healthcare is about people.
Yeah.
It's about understanding their needs, their beliefs, their aspirations. It's about tailoring our approaches to fit those unique circumstances, not the other way around.
It's about moving beyond the one-size-fits-all mentality and recognizing that true progress requires collaboration, sensitivity, and a deep respect for the communities we're serving.
Well said. And it's a lesson that applies not just to Himachal Pradesh, but to healthcare systems around the world.
Absolutely. So as we leave this deep dive, let's carry that reminder with us. Let's stay curious, stay engaged, and continue to advocate for healthcare systems that prioritize people above all else. Thanks for joining us.